Welcome to episode 46 of the LorainCounty.com Insights podcast. I'm your host, Ed Skimmon. This episode is made possible thanks to the generous support of the LorainCounty.com champion sponsors, Emerge Inc., Lorain County JVS, WOBL Radio, Lorain County Community College, and Community Foundation of Lorain County. Today we're talking with Don Schiffbauer, CEO of Riveon Mental Health and Recovery. Join us as Don talks about the merger of the Nord Center and LCADA Way that led to the formation of Riveon, the broad range of mental health and addiction recovery services they provide, and the impact of innovations like telehealth. Don also shares insights on the upcoming Lorain County Crisis Recovery Center, his leadership philosophy, and the importance of community support and self-care in the recovery journey. From my perspective, the Nord Center and LCADA Way merger is a model for merging organizations that benefit their clients and the community. Before the merger, over 60% of LCADA Way clients also had a mental health diagnosis. Riveon now offers coordinated dual diagnosis treatment, combining mental health counseling, psychiatric support, and addiction recovery all under one roof. For Lorain County, that means residents experiencing both mental health struggles and substance issues can receive cohesive, personalized care, drastically reducing gaps and miscommunication between providers. Here is my conversation with Don Schiffbauer.
My name is Don Schiffbauer. I am the CEO for Riveon Mental Health and Recovery, formerly the Nord Center and the LCADA Way, a merger that became effective July 1st, 2024.
Welcome, Don. Thank you for joining us and sharing your insights. Could you provide an overview of Riveon Mental Health and Recovery and your role within the organization?
Riveon Mental Health and Recovery is a newly named organization, but an organization that is comprised of two previous organizations that have had a long history of high-quality behavioral health care in Lorain County and surrounding areas. The Nord Center, which had provide comprehensive mental health services from child and adolescent all the way up to adults, and the LCADA Way, which is we say substance use disorder, but for the public, it's addiction services. Outpatient services, medically assisted treatment, counseling services, residential services. And what we found is that these two organizations over the years would collaborate on delivering care to almost 8,000 to 9,000 individuals within Lorain County. It wasn't until a couple of years ago that the two organizations realized we can do this better and more effectively as one organization. Hence the merger between the two organizations, and we, metamorphosized into a new organization called Riveon Mental Health and Recovery. And some of your listeners may be wondering, how'd you come up with the name? Riveon was actually a culmination of a lot of input from community stakeholders, clients, staff, and we have literature that explains it. But in short, Riveon represents a river. And if you're not a geology major, which I am not, I didn't know rivers aren't meant to travel in a straight direction. And our lives can be seen the same way. We take lefts, we take rights, we take curves, we encounter barriers, maybe rocks, maybe uphills. But what we know about rivers is that regardless of the obstacle or path that they take, they always get to their destination. And at Riveon Mental Health and Recovery, we're treating that person like the river and helping them overcome their obstacles and get them to a place where they can live healthy on the road to recovery and healing.
Can you talk about the services that Riveon provides and the individuals and families you support?
I think we'll start with what we don't provide. We do not provide inpatient psychiatric services. So when people think about getting admitted to the behavioral health floor at a hospital, we do not do that. And then there's not much else that we don't do. First of all, we serve ages, child and adolescent, all the way up through adult age and elderly. Our services are broken up into two major disciplines: substance use disorder or addiction services and mental health. In the mental health side, we provide your traditional outpatient psychotherapy counseling sessions. We also have psychiatry, nursing services. We provide case management where we can help deliver that mental health care and behavioral health care out in the community where our clients live. We provide a lot of transportation to assist them to get to their appointments. We also are the center for Huron and Lorain County for rape crisis and sexual assault. We have a strong partnership with the Lorain County Prosecutor's Office, as well as local law enforcement, to help provide services to victims and survivors of rape and sexual assault. Again, child and adolescent, and adults. We are the largest provider of residential services for people with what we call severe and persistent mental illness, basically people with mental health problems. We have several group homes here in Lorain County that serve as a permanent residence for people experiencing mental health issues. And then lastly, on the mental health side and the addiction side is we operate 988, which we'll talk a little bit later, but it's a 24-hour hotline for people to call for behavioral health emergencies. On the addiction side, we provide women's residential treatment where not only will we take care of the women to assist with their addiction treatment, but we also provide childcare services. You can imagine a young woman coming in that might have a child or two, and they want to focus on their recovery, but they're worried about who's going to care for their child. How are they going to feed their family? We provide a space where we can provide childcare and a roof over their head to allow them to fully participate in their recovery process. Medically assisted treatment, which you may have heard of Vivitrol or Suboxone. These are medications that can help somebody that's struggling with an opiate addiction to help bridge their road to sobriety and healing with medication along with counseling treatment. And then a lot of transportation. It's no surprise that areas, including Lorain County, struggle with transportation. And I know there are a lot of people working hard to rectify that, but we know that we provide a great deal of transportation to our clients. And then most recently, Riveon Mental Health and Recovery has started offering primary care services. Almost half of our clients either don't have a primary care provider or haven't seen their primary care provider. These are for chronic medical issues, your diabetes, your high blood pressure, your wellness checks. People with behavioral health or severe mental illness die on average 25 years younger than somebody without. And it's not just a result of the mental illness or the addiction. It's a result that if they can't take care of their mental health and addiction, they're also not taking care of their hemoglobin A1C for their diabetes, their asthma or emphysema. Maybe it is a weight issue or a high blood pressure issue. So being able to provide care for the addiction, the mental health, and the physical health really creates an agency where we are always here, always ready, and we're able to take care of the whole individual. So that, in a nutshell, is what Riveon Mental Health and Recovery does. And we service primarily Lorain County, but we also have offices in Cuyahoga County and Middleburg Heights in Cleveland, as well as Erie and Huron County.
Can you talk about the value that Riveon provides that benefits the wider community, not just those you directly serve?
Yeah, what we know is that when we're able to provide somebody a space where they can be successful in their addiction treatment, where they can have effective coping mechanisms or a medication regimen that helps them to have control over their mental health illness, so it's them being able to live the life that they want to live, then we also know that part of their recovery is also being productive. I'm not just talking about holding down a job and making a paycheck. Being productive or being resilient is unique to every individual. But if we're able to assist them in that process, so maybe their idea of success is to have a job. Maybe their idea of success is to be able to go to the grocery store and not have to worry about getting there or getting back. That sets them up to be sustainable on their own, less reliable on potentially emergency services like fire, EMS, police, and also gets them connected with whether it's social services or resources in the community that they may otherwise not know. So there's a direct healthcare benefit to providing that level of care, but there's also an overarching benefit to the community.
How is Riveon Health funded? What are your different sources of funding?
There is no pot of gold at the end of the rainbow for this agency. Riveon Mental Health and Recovery is funded through various sources. The majority of our funding, about 65%, almost 70% of our funding comes from Medicaid. Medicaid is a state and federally funded program. A lot of our reimbursement comes from billable services through Medicaid. Another 30% of our funding, specifically for services in Lorain County, comes from levy dollars. So Lorain County has really been generous over the last several years in passing 2 mental health levies, a couple of years ago, a 5-year levy, and most recently a 10-year levy. Those dollars are used to support services not only at Riveon Mental Health and Recovery, but the Mental Health Addiction and Recovery Services Board uses those dollars to fund agencies in Lorain County for either services that aren't billable to Medicaid or services that are needed to provide a comprehensive behavioral health system for the community, but don't necessarily have, I guess, sustainable funding sources for it. We appreciate the work that Michael Dowd and his team do over at the Mental Health Addiction Recovery Services Board in, one, being able to be fiduciaries of those dollars and managing them, but also ensuring that Lorain County has minimal gaps in terms of behavioral health services for the people that reside here. We do take commercial and private pay, and then we also have a smattering of people with self-pay. And then we do have grants. We're very thankful for the local philanthropic agencies, Nord Family Foundation, Community Foundation of Lorain County, Community West Foundation, just to name a few, that have been generous in affording us some funding opportunities to support some initiatives to support workforce development, crisis services, and so on.
Were you part of the organization before the merger, or did you come on after that?
I was. So I serve as CEO for Riveon Mental Health and Recovery now, and I was the CEO for the Nord Center prior to.
What is something you learned from the merger with LCADA Way and the Nord Center that you didn't know before the merger?
The interesting thing about mergers is when two organizations come together, I think the leaders of the organization want to think of everything that they can think of and account for when you bring two organizations together. The reality is you can't. And I think what I have learned through the merger is that you really have to maintain open lines of communication between all levels of the organization. And we try very hard to ensure that happens. But we also know that this merger just doesn't impact the people that work here within these four walls. It also impacts the 10,000 unique people that we service. So making sure that we've got a continuous flow of information to the people that we serve, because for years, they've been used to going to LCADA. For years, they've been used to going to Nord. And now we're telling them to go, come see Riveon. Making sure that the community knows that while it may be a different name, the bones of the organization, the people behind the organization are still the same. The benefit about the merger is that we're bringing these two organizations together that historically care for the same people. They compete for the same workforce. And now we're creating a singular space where clients can access services. The biggest thing I've learned from the merger is that when you think you've communicated enough, you need to communicate more, not just with your team, but also with the public. And I know it takes time, but I have to say, we have been really working at lightning speed over the last 10 months. I can't speak enough about the hard work that my team has done. And I appreciate the community's willingness to let these two organizations come together and really revolutionize the way we deliver behavioral health care.
How do you define success at Riveon? What metrics and outcomes are most important to you and your team?
We have a long list of quality metrics. How compliant people are with therapy. Are they improving in their functionality scores? How many people are we seeing on a daily basis? And those are all very important, and they tell the story of how the organization's operating. But I think for me and for most of us at this organization, the way we define success is through the eyes of our clients. I don't look at the world through their lens. My version of success or my interpretation of success is going to be way different than your perception of success. And I think as an organization, while yes, we have to measure these particular quality outcomes and stuff, we really have to remember to not lose sight on what success means for our clients. And I don't think it's a certain functionality level or percentage that we're hitting. It's when you come back in and it's a thank you, or it's, hey, I was just able to hold down my first job for a month and I haven't been able to do that for 10 years. That's how we measure success. And the ability to have that feedback from those clients outweighs any graph or percentage or quality metric. That's how we define success.
Let's switch over and talk a little bit about you. What's your background and what led you to your current role?
My current role as CEO, Riveon Mental Health and Recovery, I am a registered nurse by trade. My background is cardiology. I am not a behavioral health expert, but I don't need to be. I work with 400 of them, and it is a privilege to serve alongside them every day, providing services to Lorain County and surrounding communities. I have been a Lorain County resident since 1985, and I have worked the majority of my career at what formerly EMH Regional Medical Center, and then in 2014, they merged with UH. So I've been through the merger process before. I took the administrative route at the hospital, and I found it to be very rewarding, but also very humbling at the same time. And when the opportunity arose to come to the then Nord Center back in 2019, I get to work with everybody in the community that I've worked with for the last 25 years. I think as a leader of an organization, it's about having those relationships and being able to not only foster those relationships and use them to support the mission of the organization, but also your willingness to let the people that are doing the work actually do the work. My job is not to tell people how to provide behavioral health. My job is to get them the tools and resources they need to do their job. And it has been about 5.5 years. It's been extremely rewarding. I'm very proud of the work that we've done. And I look forward to bringing about a service to Lorain County that is really going to cement parity between behavioral health and physical medicine in the way we offer access to emergency care.
Besides the merger itself, in the time you've been with Riveon, what are you most proud of accomplishing?
What I'm very proud of is, and I say this with all due respect to the behavioral health space, but if you think about a global pandemic and we think about agencies that are prepared for disasters and stuff like that, that's not something that a behavioral health agency, when I say they don't think about it, it's not that they're not prepared for it, but it requires a different mindset. And what I'm most proud of is the way that both agencies, Nord and LCADA, and now Riveon, were able to pivot very quickly and not miss a beat in terms of how they were able to offer services during the pandemic. There was a latent influx of depression and addiction and alcohol abuse as the pandemic droned on. And these two organizations were poised to be able to assist with that. We stood ready during the beginning of the pandemic and we're like, all right, where is everybody? Everybody was still full of adrenaline and we're going to do this. And then as the months went on, then we started to see the latent effects it was taking on people's behavioral health. And that's where we needed to come in. So our moment to really contribute to the management and overcoming the pandemic didn't happen until several months in. And that's what I am most proud of. And out of that came new ways to provide care. 40% of our business right now is done via telehealth. People talking into microphones just like this over a video screen. And they're able to do it in a setting that's comfortable for them. They don't have to wait for a bus to take them to their appointment. They don't have to worry about not having a car, or maybe their car's in the repair shop, or maybe it needs repaired, but they can't get it fixed. So the pandemic has really forced our hand to come up with innovative ways for people to access care. And our ability to react quickly and then learn and adopt some of those practices more long-term, that's what I'm most proud of.
As we drove in, we saw a nice building next door. Do you want to talk about that?
I've been waiting for you to ask about it. Yes, there's been a lot going on, and we've talked about it in several spaces before, but the building you saw is called the Lorain County Crisis Recovery Center. Now, people are probably saying, what the heck is that? The Lorain County Crisis Recovery Center is essentially a behavioral health emergency room and detox facility. As a hospital administrator and overseeing emergency operations, emergency rooms do a really good job at providing emergency care services to the entire community. Regardless if you come in for a stubbed toe or a heart attack or a psychiatric emergency. However, people that come in with acute behavioral health issues may not need that level of care or that type of care. In this particular space, they come into a space that isn't riddled with gurneys, getting them undressed into gowns and letting them be in rooms. It's a living room-like environment with recliners, open spaces, warm colors that creates a sense of security, a sense of dignity, and helps to reduce the stigma associated with behavioral health. So the Crisis Recovery Center is 2 floors. The first floor will be the behavioral health emergency room. It's comprised of about 16 recliners. And we do have 2 private rooms if we have somebody with special needs or special considerations come in, if we have a child and adolescent that needs their own space, or maybe somebody comes in and they just need a little bit more time to de-escalate or deal with the crisis that they're coming in with. That's the first floor. It is not inpatient psychiatry. People are not staying there days on end. It is a 23-hour observation model, just like an emergency room where we get you in, we stabilize you, we assess the acute problem, and then we get you dispositioned or sent to the right level of care, whether that's inpatient services, outpatient services, or if you're coming in for withdrawal symptoms or detox, you can go to the second floor. The second floor is 16 private rooms for adult chemical and alcohol detox. Why 16 rooms, Don? We send out on average about 750 people to detox centers outside of our county, really good detox centers. But we talked about transportation earlier on in this podcast. And what I learned from the merger that I was part of with Elyria Hospital and UH is people don't want to travel to get their care, regardless if they have transportation or not. They want to get the care where they live. So we had an opportunity to provide high quality detox services within our community. So that second floor will be a level 3.7 of the American Society of Addiction Medicine, which I won't get into here, but it's your traditional inpatient detox. And the nice thing about it is if somebody comes into the first floor to the behavioral health emergency room and they need detox services, they're not waiting 24, 48, 96 hours. They're escorted by a peer support specialist, somebody with lived experience that knows exactly what they're going through. They walk over to the elevator, they hit the second floor, and up they go. That center is slated to open October 10th. But that center is not just a Riveon project. That center is a multi-year, multi-agency project. It is being led by Riveon Mental Health and Recovery and the Mental Health Addiction Recovery Services Board of Lorain County. Again, Michael Dowd and his team for supporting the capital campaign, assisting with the construction of the building. Riveon will provide the clinical services out of that building. We also have to thank our philanthropic agencies, Community Foundation of Lorain County, Nord Family Foundations, Kelly Dieter, Dick Stein, Nathan Manning, Gail Manning, the Ohio legislator for supporting capital dollars to build that. Former Senator Sherrod Brown for his federal support through congressionally directed funds. Another family that we want to thank is the Mike Bass family for being one of the first community members to put dollars towards that center. It has been a long process to not only bring together the funds for the crisis center, but also putting together the workflows. And quite simply, it is going to revolutionize how we deliver emergency behavioral health care. I am extremely proud of that. Earlier, you asked me, what am I most proud of? If you talk to me in a year from now, it's probably going to be that.
Going forward, what are your personal goals? What would you still like to accomplish?
I won't focus on my personal goals. My personal goals is when I retire, fish and spend some time outdoors and lots of times with my family. But I think professionally, when I talk about goals for Riveon Mental Health and Recovery, I think first and foremost is to ensure that we have a model of comprehensive healthcare delivery where we're able to take care of the whole person, where we have a comprehensive model of healthcare delivery that is here in Lorain County and surrounding communities long after Don Schiffbauer's out of the role. A model that is sustainable on billable services through insurance and Medicaid, and one that continues to provide a stigma-free environment where we provide care to everyone and where we're able to provide care in a manner that doesn't rely on anybody's ability to pay. So our long-term goals are to continue further integration with addiction services, mental health services, primary care services, so that Riveon Mental Health and Recovery can be that one-stop shop. People with behavioral health illness, it takes a lot for that person to build up the courage to want to seek services. The last thing we want them to do is have to walk out of our doors and go to another place for addiction or go to another place for primary care. We need to capitalize on that courage and get them connected with the resources when they need it and where they need it.
You mentioned fishing. Outside of work, what are your hobbies and interests, and how do they help recharge you?
Early on in my career, I found myself to be an extreme performer. It was go, go, go. I don't think it's until you get a little older, like me, then you realize that, and I say this to my employees, we work to live. We don't live to work. What we do is very important. However, we can't do what we do and do it well if we don't take care of ourselves. So yes, I do enjoy fishing. I do enjoy being outdoors. I enjoy going to World War II seminars with my dad and checking out a lot of history. My wife and I and my family like to camp a lot. And now that the kids are older, I'm sure we're going to be camping out where they're living. So spending a lot of time outdoors and ensuring that I have the ability to recharge my batteries, and also making sure that my staff understand that that should be a priority for them. I'm going to say that having lived in Lorain County for so many years, There's no shortage of being able to recharge your batteries anywhere in this county. There is a lot to do, from the lake to the Findlay State Park. I know this is not a Lorain County commercial, but there's a lot to do, and we're very fortunate to have it right in our own backyard.
Anything I left out that people should know?
Yes, I think one of the things I wanted to make sure your audience knows about is 988. Our county has had an 800 hotline number for many years. 988 is essentially the new 911, but for behavioral health emergencies. And Riveon Mental Health and Recovery is one of 19 call centers within the state. People can call 988 24 hours a day, 7 days a week. They're going to talk to a behavioral health professional that is going to provide an assessment over the phone. They're going to determine whether or not they need to send out a mobile crisis response team, or if they need to go to the crisis receiving center when it opens up in October. But your listeners need to know that if they're experiencing a behavioral health emergency, whether it's mental health or addiction or withdrawal or whatever, pick up the phone and dial 988. It is absolutely critical, and it's at no cost. And we will collect as much information or as little information as the caller wants to provide. The other thing I would want to reiterate, and I've said this a couple times, is at Riveon Mental Health and Recovery, we want people to get the care when they need it and where they need it. And we don't want the ability to pay to be a barrier. We have same-day assessments where people can walk in between the hours of 8 and 2 at any one of our facilities to get a comprehensive assessment. We have a behavioral health urgent care in Sheffield Village on 5425 Detroit Road that provides services, I believe, 9 a.m. to 5:30 p.m. And it really is just a behavioral health urgent care. I've been to urgent cares. I like them. They're quick. They're easy. And we know that we should be able to provide that same service for our behavioral health clients. So if you're ever in doubt or ever in need, just please pick up the phone and call or walk in. Riveon Mental Health and Recovery will always be here, and we will always be ready.
Finally, where can people get more information about Riveon Health and connect with you?
They can go to riveonhealth.org. And on that website, they can scroll through our services. They can scroll through our leadership team. If they need to get a hold of me directly, my contact information is on there. Chances are I'm going to connect them with somebody way smarter than me to get them the answers that they need, but happy to take those calls at any time. riveonhealth.org, RIVEON health.org.
Thanks, Don, for your time. I appreciate your insights.
Wonderful. Thank you very much for the opportunity.
Thank you for listening to the LorainCounty.com Insights Podcast. Each episode, we share conversations with the people shaping life in Lorain County, from business and government to education, nonprofits, healthcare, and entertainment. Be sure to follow or subscribe on your favorite podcast platform so you never miss an episode. You can also visit LorainCounty.com to discover local events, volunteer opportunities, and more community resources. If you know someone who's making a difference in Lorain County, send us a note at podcast@LorainCounty.com. We would love to share their story and insights. Special thanks to our producer, Leah Gerke, and to you for listening. This has been the LorainCounty.com Insights Podcast, conversations with the people shaping Lorain County.